Hi, good day. I'm Keisha from Care Nursing Agency, and today we're going to talk about a healthy 2021. This is the new year, so happy new year to all in TV land. What is health exactly? It's a state of a complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So we are dealing with health and what we can do to make things better. A healthy lifestyle is one which helps to keep and improve people's health and well-being. At Care Nursing Agency, we want to work at promoting healthy lifestyle changes, and we want to ensure that the measures and benefits of these changes are noted, including weight, blood pressure, blood sugar, blood cholesterol, etc. Here with me this morning is the great Dr. Pierre. I'm so happy to have him here with us as our sit-down session dealing with a healthy lifestyle change for 2021. Doctor, welcome.
Thank you. Thank you, Keisha, for having me. Always a pleasure to participate in your activities, which I think there's so much social good coming out of care nursing that it's impossible to turn down the opportunity once it presents itself, even those that come on such short notice. But more so because this topic is one that is so dear to my heart. I was just talking before we started the show about some of my conversations with Social Security and other stakeholders in terms of how we create a healthier federation. Yes. And how that is going to have ripple effects in a very positive way on one of the greatest complaints that is being spoken about right now is just the number of sick leaves that people are forced to take because people are unhealthy. Also is going to have a ripple effect as well on our hospital. The burden that we see on the medical ward, I think you are now the sister on the medical ward, so you can speak to that.
Yes.
And just the fact that we're seeing so many young people today with diseases that we once considered diseases of the elderly.
Yes.
And that is very disheartening. And I hopefully by the end of the show we'll have touched a couple of people who will be willing to go out and start making some changes almost immediately.
Well, I have my notepad right here and ready to go because I too am going to take notes. Tell us, one of the first things we want to talk about definitely is getting adequate rest daily. Yeah.
And that is very, very dear to my heart as well. I was just telling somebody actually yesterday, for the first time in a long time, I think I might have slept combined, not straight, but cumulatively, about some 11 or 12 hours. And I hadn't done that in, I cannot tell you how long. People who know me know I sleep an average of 4 hours a night. It's one of the occupational hazards. I've worked in an emergency room setting for most of my career, throughout medical school. If you were asleep at 9 o'clock in medical school, it's almost unlikely you'd make it to become a doctor. It's almost a tool of the trade that you needed to learn to be an insomniac. So I said to someone yesterday, I had paid down on my sleep debt. And she laughed, and I said, yes. I said, so many of us are walking around with a sleep debt. We pay down our car loans or mortgages, but we have a sleep debt. So many of us who should be getting proper sleep, proper rest, we aren't. And herein lies the difference, because people say, but I was in my bed all night. Well, sleep and rest are not necessarily the same thing, and we use them interchangeably, right? When I go to bed for 4 hours, I rest for 4 hours, right? And there are those people who are in the bed for 10 hours and wake up feeling more tired than before they went to bed.
Right.
And you ask yourself, why? Well, one of the things that I do is that I recognize as well when my body is calling for, the thing is, let's just stick a pin here for a minute. There's no cookie cutter solution to this. I can't say go sleep 8 hours, everybody should sleep 8 hours. This is what literature says, but we recognize that the world has moved beyond that. We no longer live in the factory where everybody worked 8 to 4. Right. I'm sure you just came off a shift,
yes.
Right? You haven't had a chance to really get any sleep as yet?
No.
Right? I mean,
that's normal.
So do we tell the nurse to stop working or stop doing what he or she needs to do?
No.
The question is, how can we, in all this busyness that we call our life, how can we recognize the value of proper rest? Now again, I want to emphasize rest and not sleep, because they are not the same. If you go to my home right now, one of the things that you might find most striking is that everything in my bedroom is white in terms of my linen. It is what helps me. It is almost like I call it the hotel effect. When I go to a hotel, the idea of bed sheets being white tells me that they're clean. And that always gives me the sense of a clean environment where I can rest comfortably. 2, if there's an investment I make, it's in my bed, in the quality of my mattress, the quality of my pillows. Another thing, temperature, for me is extremely important. The place I'm resting has to be at a temperature that allows me to rest comfortably without losing too much body fluid, because a number of individuals, you see some people sleeping in some conditions and sweating profusely, right? The body is becoming completely dehydrated in the process, right? So temperature, the quality of the room, of the environment is extremely important. Sound. So I shower, my windows are closed. I have invested in air conditioning. I understand not everyone can do that, but proper ventilation. It's unfortunate that we see people building homes even today and they don't take ventilation into consideration. If you don't have a proper exchange of air in the room, obviously you cannot get the right quality of rest that needs to be had. Another thing as well that's important is a lot of people fall asleep. They don't go to bed. There's a difference. If I am on the couch watching TV and I crash, and I want to wake up and the TV is watching me rather than me watching the television, that's not proper rest because I'm not in the right environment. My mind knows that. And if you look at the quality of sleep, most of that sleep is REM sleep, which is random eye movement, which means that the brain is not at rest. The brain is working just as much because the brain is in an environment that it does not associate with rest, even if you may be sleeping. So at 1 o'clock you get up, and perhaps, like most people I know, that's when you jump into the shower because you came from work. You don't want to go into bed because you haven't showered us yet. You crash. Then you get up, you go shower, and you're trying to fall asleep again, tossing and turning because you're now fresh after your shower. 3 in the morning, you haven't slept yet. And then before you close your eyes, it's 6 in the morning. And if you have kids, some of them wake you up before you can even decide to wake up, right? Of course you're going to wake up and you say, well, if I came home since 9 o'clock last night, and I wake up next morning, and at 8 o'clock, I'm going back on the job, and I still feel just as tired. That is the scenario that most people will paint today if you ask them about the quality of sleep. And I ask my patients every time, walk me through your Mondays, your Tuesdays, your Wednesdays, so I can understand. Because people say, well, doc, there's no tonic I can get to boost my system. And you walk around and you see this 5-hour energy thing and the ginseng shots all around the place. Those are things that are saying, well, there's no solution to getting proper rest, so therefore you need something else to boost you and to keep you going. This is nonsense. 4 hours of proper rest for me is equivalent to somebody's 10 hours of tossing and turning in the bed. I get up after 4 hours, I feel completely refreshed because I've rested for 4 hours. I didn't fall asleep. I came home, I showered, I turned on the AC in my room, 23 degrees, my sheets are clean, I put on some relaxing music, I do what is called a reflective practice, meaning that I put everything that has happened throughout the day, I allow it to settle into my mind, I do a bit of meditation, and I go to bed. I make a conscious decision that at that specific time, the lights go out, come what may, my phone is away from me, right? A lot of individuals go to bed and the last thing they've done is something that has stimulated their brain so much. Instagram, social media, a scary movie, things that have left the brain in a high state rather than a low delta state, which is where the brain needs to be to allow you to go into a state of rest. Most individuals don't do that. So falling asleep is not the same as going to bed. Sleep is not the same as rest. And we need to make those distinctions.
Okay. Getting regular physical activity, exercise.
Right.
How does that fit into our busy schedule as it is?
Absolutely. And you know, people say to me all the time, boy, doc, I want to exercise, but I'm so busy. And I say to them, well, that sounds to me like if you have your car and you're driving around and say, I'm too busy to stop and put gas. Because those of us who know that when that tank hits E, no matter how long the line is at the gas station, we'll stop them, put gas, because we know we can't go anywhere else. It's the same thing that happens. If you tell me that you cannot fit 20 minutes of exercise. The average thing is 150 hours a week of vigorous activity. That's what you need as a baseline. 150 hours. You know how many hours you have in a week? About 10,000 hours. If you work an 8-hour job, 2,400 of those hours are spent working. So in 10,000 hours, you cannot fit 150 into exercise. Sorry, that's 10,000 minutes, not hours. Into exercise, 150 minutes a week. That's what you need to exercise. Sorry, not hours. 150 minutes. So you have 10,000 minutes in that week, and you need 150 from those to exercise. Most people think that you need to go for 3-4 hours, go to the gym and dedicate a whole day in the gym. No, if you do vigorous exercise for at least 20 minutes a day, brisk walking, faster than you've walked normally, to get your heart rate up there into a zone where you burn calories. If you can do that, you would be on track to having healthy activity. You don't have to go walk all the way to the peninsula and back. You don't have to climb that big hill up on the peninsula. I see people walking and I admire them. But I'm saying that a lot of people are looking at this and saying, if I can't make that commitment, then I better not do anything.
I think that's why people don't actually get to continue.
Right.
Even if they start, it's not sustainable, it's not realistic, because you get burnt out and you probably injure yourself more too.
Absolutely.
With your tendons and your ligaments get sore and swollen.
Exactly.
So you can't sustain that lifestyle change in implementing exercise, because we think we have to meet a certain criteria, and we have to get the exercise gear to go with it, and all these added things that are not really necessary.
Yeah.
But as you said, moving 150 minutes per week helps vigorously.
And you touched something very important here, which I think is so important to understand lifestyle change. Right? Because one of the reasons why people get frustrated, Keisha, is because people have very unrealistic goals. You've taken 20 years to put on 100 pounds and you want to lose it in 1 month. Unrealistic. You've taken all this time and you have this adipose tissue that is now very hard, right? It's not, you don't want to burn that very easily, and you want a magic formula because carnival is coming, or a wedding is coming up, or you're feeling to address, and you want to just lose that weight, you want to shred that. Some people ask me for Lasix, people ask me for thyroid hormones. They will do whatever it takes, and I'll tell you, look at how marketable it's become, right? How many diet teas and diet fads are there out there right now, because people have recognized that there's a way to monetize people's eagerness to lose weight very quickly. But if it's a lifestyle change, you recognize that losing weight immediately is not the biggest thing, but to do something, to engage in an activity that you can continue to do consistently for a very long period of time. And if you can do that, so you don't need to go and say, well, some people, here's some of the excuses I hear why people don't exercise. Well, they don't have proper workout thing. They have to be waiting for the sister in the States to send some clothes for them to go and work out, and that's exercise. That's one of the reasons. Well, they don't have somebody to go work out and work out with. So and so had said to them that they would have come. The person didn't come. They don't have money to go to the gym. Or some people are ashamed of the fact that I'm so big, I go on the road, I'm going to feel very intimidated. If I go to the gym, I'm going to feel very bad. Well, let me tell you something. You are making a decision for your life, whichever your decision is. Right? Because just look at what obesity is doing to us, right? And it's not just the NCDs that we know of, diabetes and stroke and hypertension and heart failure. Chronic pain. A lot of people today are living in pain, and it's because of weight. That our bodies were never designed to carry that amount of upper body weight. I saw a child in Barbados, if I left Barbados, 9 years old, who needed hip surgery. Why? Because the hips were actually coming out of their socket because of the amount of upper body weight. So they need to do something to reinforce that. Because imagine that, a 9-year-old, right? So this is the world where we live in, where we consume much more than we burn, and most of us are couch potatoes. All of us driving because the car is a status symbol, even if we live in this nice small island. But also as well, which we discussed earlier, we need to also create a nation in our nation building, our advancement plans. And something I will speak to the ministers of health about in every country that I've lived, that you need to factor those things into your developmental plans. build roadways that encourage people to walk, build parks. If you, I went to Turkey once, and I was around the Aegean Sea there at a beautiful hotel, and I just took a walk, and every couple of blocks along that seawall, there were exercise equipment that you could exercise people. So it encourages that sort of lifestyle. So it has to be something where, I understand the struggle, Keisha. Exercise is not pretty. It's like sex. It's hard in the beginning, it's messy in the middle, it's sweet at the end, right? But in a bad way, because you start exercising, and let me tell you something: the soreness in your joints and the pain you feel, and you feel like you cannot breathe. You want to vomit.
You want to give up immediately.
Right? So we have to be realistic. This is tough, but it is the best gift you could give to yourself this year. And I believe that we must also lobby our politicians, and we must lobby our ministers and our leaders. Companies right now that are setting up should not set up without a gym. Our hospitals should not be without a gym.
Right.
Because our nurses like Keisha, who just left work this morning, should say, before I go home, I'm going to burn an hour on a treadmill.
Right.
And then go home. Because her shift is in such a way, and she wants to give 150% at work, which is demanded of her. You have to sometimes bring the healthier lifestyle into the workplace.
Right.
The foods that have been sold at our hospital, if you want to go outside, you're working all night there and you want to go and get something healthy to eat, there isn't a vending machine with an apple or some kind of fruit, right?
Sugars.
The things we sell in the hospital setting are those high caloric foods.
No food.
Right? No fruits. So that sort of lifestyle we talk about, it has to be far more comprehensive. It is well beyond, and let me tell you something, every one of us is being affected by it.
Yes.
Every one of us has been affected. There isn't a single person who hasn't been affected. Obamacare in the US, and I'm digressing a little bit, one of my biggest complaints about Obamacare, you know what it was? It was that I was making an effort every day to run along the East River in New York City. And I would see people not doing anything, and then my premium for healthcare was so much higher. Why? Because I had to contribute for those individuals who chose not to exercise. So you have to spread that burden. And that's what's going to happen to our insurances. Our premiums are going to go higher, right? The productivity in our country is going to go down. We are going to suffer as a result. The problem with Social Security right now is exactly that, where your children and my children will not have Social Security for them to get by the time they get to that age. Because people are taking it so much earlier now. People that depend on Social Security checks from the age of 40 because they're disabled.
Yes.
There won't be a Social Security fund for our children if we don't start making those changes. So ask yourself whether this is a personal issue or whether it's a national issue. It is a national issue.
Right.
We are in crisis.
Yes.
We have diseases that we cannot afford to treat. And we have people who are alive but with no quality of life. Disability adjusted life years. 40-something-year-old people, before I left GNF, was one of the last things I did was to give somebody disability at the age of 42 years old. That's younger than me. 42 years old and you're disabled. Cannot work.
That's sad.
Ask yourself whether we can continue along those lines. We cannot.
No.
Our nation is in peril. So I'm asking everyone, everybody who's looking right now, whether you're in your home, whatever your position is, whether you are the manager, the owner of a business, start thinking of either giving don't give your staff a ham and turkey at the end of the year. Give them a gym membership. Give them a gym membership. If you work with Social Security or if you're in government, start the next highway you build a footpath alongside it that encourages people to walk. Put billboards up around the place to encourage people to engage in get off the couch. Organizations can do it. The banks can start it. It doesn't always have to be the doctors and nurses like Keisha. You've started something here today and I'm proud to be part of it. But right now, people need to pass that torch on to others, like the Olympic torch, and others to carry that flame. I got a little passionate here, but it's because this is so, I'm covered in goosebumps because this is so dear to me because I see it. It's in my family, it's in my home. I have people in my family who I have to now take money out of my pocket every month to care for them. People who should be out there working and earning their keep, right? I tell people every day, if you have a stroke, you think that's the worst thing? No. Death is not the worst thing if you get a stroke. It's if you stay alive. Yeah. And you're 40 years old and a whole side of your body is dead. You have no value to your family anymore. Right. You are a burden to them at such a young age. And the worst thing that, because you're young, you're there for a very long time. So imagine you're 40 and the next 30 or 40 years, somebody has to dedicate the child who should be going off to college to study or should be building their first home has to put that money to caring for you.
You just said something about being a burden, and sometimes we don't want to talk the things, and in our setting we wouldn't want to say that, but it's the truth. We become burdens to our families, and people don't realize the burden is so tremendous. It takes a toll and it breaks down the family system that is already broken down. Yeah. Because people have 100 jobs and trying to make ends meet. And I'm very passionate about what we are speaking about too. It breaks my heart because I see it all the time. People are not taking care of themselves. Right. So that's why we are here, right?
Absolutely.
Okay, and eating more plant-based foods. We have started to, Care Nursing Agency has started to eat more from the pot. The reason why I went back to the pot, we have clients in their 90s, almost 100, maybe 2 of them, and we asked, what do you eat, or what did you eat, or what have you been eating all these years? And they tell you ground food, vegetables, plant. And I started trying to initiate that in anything I do, anything I put in my mouth. I'm very conscious now, because apart from weight gain, we want to live long, and you can't be talking to people and educating them and you're not doing it. So we have started, but could you expound on that some more? Because we have a lot of fast foods in St. Kitts, a lot of quick fixes, a lot of juices and things that are more, not only saturated with sugar, but even sodium. You'll read the labels and you'll see this high content of salt. What can we do? Because as a nation, we are not healthy, obviously, but we can do, it's a nation thing, yes, but individually, because individuals are watching, what can we do to help?
That's such a great, it's such a great point you raise, and it's one of my struggles, even in my home, and I'm here, and my preaching is, I don't want it to come across as being hypocritical, because I struggle with the very same things. I struggle with my weight. I go up and down, I fluctuate. I have been in the best shape of my life and the worst shape of my life. I was once over 300 pounds. So I know what it's like to struggle with those problems. I've had my cholesterol at levels that most people will never have their cholesterol, hopefully. So this is not me speaking as a doctor. I'm speaking as a doctor who also struggles with the same things. I'm sure you see a lot of your healthcare workers who struggle with their weight as well, right? I mean, a lot of us, Keisha, sometimes you go to your shift there, and it's not because you don't want to really peel a yam and dash in and so on and cook something, go back to the basics, as I call it, right? Those basic food groups. It's not because you don't want to do that, but it's the time. You really do not have the time to dedicate to it. It's between you trying to stretch the little paycheck you have, trying to supplement it by doing a second job or something, right? Caring for your child or for your spouse or for your home. It's difficult, and sometimes those other foods are so accessible, right? 869
to go,
right? And that's it. They're very accessible. If you look at the menu of foods, it's sometimes you're hard pressed to find something very healthy and nutritious on those things, and because those other foods that are processed are cheaper, right? And as I said, let's make no mistake about it. I had a friend of mine in Canada who I had a long debate with, and she was so critical of individuals who eat unhealthy. I said, you have to recognize that this is an addiction. Those processed foods, they taste better, right? They're made to coat our palates with certain flavors to ensure that we continue to eat them. I mean, there were studies done on mice that showed that mice who were addicted to cocaine, when they give them sugar, after a little while they refuse cocaine and it's the sugar they wanted, because sugar is 10 times, 100 times more addictive than cocaine. So high fructose corn syrup, which is a staple in most of those processed foods we eat, has that very same effect, right? We start our kids very early on sugary foods, and we say get a sugar rush. But what we're actually doing is training their minds to become so addicted to those processed foods that when they're older, it's very difficult for them to make different choices. Those are the foods that have very, very high glycemic index, right? Those are the foods that will spike your blood sugar like crazy, high, keep it there for a little while, and before you know it, you're hungry again. As opposed to those back to the basics, the yams and the dashings and the tanyas and so on, those foods that come from the ground, right? We call them complex carbohydrates, with a low glycemic index. When you eat those things, our grandparents and so on used to eat those things, and when they eat that for breakfast in the morning, they go out and work the whole day. Remember a few years ago that the Olympic Committee wanted to ban Usain Bolt because his breakfast included yams and so on, and they felt that those foods gave him a sort of an unfair advantage, right? It is because those foods, they keep you filled for much longer time, so they don't raise the blood sugar quickly. So you never get to the threshold where your body cannot get rid of that sugar. So if you're type 2 diabetic and you have some insulin being produced, right? It's like your body doesn't have any insulin at all. Your body can assimilate because the sugar is not so much coming all at once. And because it goes slowly throughout the day, it keeps you filled so much longer. So you don't have to eat several times, because that eating several times doesn't mean that your sugar is low. It just means the sugar is not getting to where it needs to get, because it has overwhelmed the body's capacity to deal with that amount of sugar. And this is why going back to those things, to those basic food groups, those things that our grandparents grew up on and so on, is going to be so much better. Now, I recognize that it's hard to just tomorrow, your kids who are used to having pizza and hot dogs and whatever and so on, and macaroni and cheese, to just one day they come home and suddenly you have a pot of dashing or something cooked. It's a challenge, right? Yeah. But what we have to do, and this is why I challenge individuals who are chefs, I say to you, I want you to take that and create a dish out of it that makes it so attractive and palatable. You understand? Throw in a little thing and make it nice and make it look beautiful. You know, when I grew up, I didn't like them, because to me, every time I saw them, they were a sign of poverty. They were so ready. I grew up in a farming family, and because we produce those very same foods, I'm like, the only reason why we're eating them is because you don't have money to buy something else. I never recognized the value, and also because I'll tell you straight, I love your mom, but sometimes the way it was prepared, it just looked. You saw this big block of dashing or something in a pot, and you just said, well, but what is this? And I made, and you ate that thing, and sometimes you felt like it was choking you because it couldn't. You know, it really was unpleasant to eat back then. But you know what? Somebody gave me one day. I was in New York, and somebody gave me some chips to eat, and it was dashing chips. They'd made dashing chips. They'd made, and they don't fry it in oil. They spread it with vegetable oil and put it in the oven for a little while, so it was nice and crisp. Nice. Dashing chips. I've had it. Right? And I was like, if my mother had done that, I mean, I would have certainly been eating dashing, right? But every time, even as an adult, I recognize the value of those things. So, but I still struggle with eating them if they're prepared the same way that I did before. So I'm saying, you know.
The key is really to be creative.
To be creative about it. Use the simple and be creative about it.
And YouTube is out there, so we could try new things.
It is.
Search, and I'm sure you'll find a recipe for every vegetable.
For everything.
Yeah.
Everything, and you can substitute. I made, the other day I made a mac and cheese, but with cauliflower. Right? And they who couldn't tell until after I said, how do you feel mac and cheese? Say, yeah, but the what pasta was that you used? I said it wasn't pasta, it was cauliflower. And couldn't believe that it was a cauliflower rice. Right, so those things that we can find very creative ways to use them. Even use cauliflower to make a pizza crust.
Yes, absolutely.
Right, so there are very, very creative ways to use those very same things. And if we did that, I think we can begin to see some shifts in those sort of figures in terms of mortality and morbidity in our country.
One of the things I wanted to see more of, I mean, we've heard it before, a farmer's market. We have a lot of farmers here, but we need to have a big bang, like let everybody go back to growing food, let the farmers teach us, you know, and then even if we can't always have them sell all their products, because you know, if everybody started, they won't get any sales, but we don't want to stop them from selling, but educating everybody else around so that even if I am the farmer and I grow potatoes and carrots, you could do something else, and that way we could buy from each other. So we still would be buying and selling, but at least have a big, like how we have a big music festival, we could have a farmers market or farm fair, something extravagant to attract people, not just once a year, but have it regular, maybe every 3 months, and we see the produce. We could even have competitions with who have the biggest pumpkin. I would love to see something like that happen in St. Kitts.
Well, Keisha, let me tell you, you see me, I'm smiling here because I'm sure that if Joy Woodley is watching, anybody who knows me knows that's one of the things that I've tried, and even this Fraser is watching me as well. They would know that this is one of the things that I have been trying to get off the ground here in St. Kitts
for
a long time, because I come from New York where there's a culture of farmers market. And when you say farmers market, we're not just talking about this produce. We're talking about artisan bread. We're, you know, using all those things to make breads and cakes and so on, all those things that are vegan and you know, when you go to a farmer's market, you can go there for the entire day and you can have breakfast and lunch, because everything that's prepared is prepared from those very same foods. Because individuals, if you're a chef at your home or you're a home cook, this is where you get to try it and you put it in the market and see whether you have a market for that food.
And right there we could find the creativity that we need.
Absolutely.
So we don't always have to go to Facebook, so we have to have a conversation.
Absolutely. I have looked at that Frigate Bay lawn so many times, and this is where I wanted to have a farmer's market. Why? Because I think that it also is nice and central, but it also would cater to those expats who are already familiar, who already have an appetite for that sort of thing, and then they would actually help promote it, and actually because you know what, people, if everybody's into it, they'll be into it too.
Well, all the farmers who are watching now, people who know farmers, let them contact us, and we can see what we can do, because I think it's a great initiative. I had no idea.
Yeah, I'd be very, in fact, as a matter of fact, if Joy Woodley is my president of the St. Kitts Nevis Medical and Dental Association is watching this show, she would know that as vice president, that's one of the first proposals I had, was that the Medical and Dental Association.
You're watching, right?
Yeah, the Medical and Dental Association.
I had no idea, because I have plenty ideas actually, but it's so much I said, okay, Keisha, this is enough, this is enough, this is enough. Yeah. But I think the ideas are never enough for our people.
I found farmers market, a lot of the recipes that I found, in fact, when I became vegetarian, vegan, it's because of farmers market. I suddenly, because my biggest fear was, where would I find food to eat?
Because you have to have replacements.
You know, yeah, and also too as well, not only where would I find food to eat, but I grew up in a bakery. I love bread. If it wasn't for bread, I would have a six-pack. I mean, I would be like, I'd be walking the road without shirt every single day, right? If it wasn't for bread, I'm telling you, I would come here without shirt, and then I get dressed here tonight before the show. Or to be just business jacket and no shirt underneath. But it's because of bread that I'm slightly deformed, right? That is the reality. So
you're slightly different. I'm overly different. Because I love bread too.
Exactly. So and bread is so accessible, right? And then in New York, I managed to get into good shape in New York, because one, there's a lot of place to walk and exercise and so on, but also the culture I found myself in, the circles I found myself in, helped to encourage that sort of lifestyle. But then I came here and discovered the $7 bread. and I'll tell you, those who worked closely with me knew that when I left JNF in the afternoon, I was driving on the Island Main Road, and I was passing K on going, because I wanted it hot. So I would drive to the source for it, right? So, I would buy 3. By the time I get to Lodge there about or so, 1 would be gone. And then by the time I get to the roundabout by the airport, another half. So I'd pass getting for a half or 1.5. I would have eaten all that bread and I just started, but because it's addictive, right? But you know what? Tying this back now to the farmer's market, I went to the farmer's market and found people who were doing zucchini bread. And and you're like zucchini bread, and when you eat that you're like, wow. And then they tell you, well, no, it actually has blended oatmeal in there and whatever and so on as a substitute for the flour.
Let me say this. So the farmers market is a whole concept where not just the farmers are there, people, chefs are there.
Exactly. Chefs
so it's like a whole team of people coming together.
Coming together. I mean, when I went, even Barbados has a great culture of farmers market as well. Even in Barbados, Hastings farmers markets and so on. You go there and on a Saturday, that's where you have breakfast. Because you go there and that's where you get your muffins, which are pumpkin muffins and so on. You get, it's really, really good. So you go there with the whole family and it's a family affair. There are tents, you sit under this and you have your breakfast. You have, if you want to have lunch, you take away your meals from there. That's where you buy your bread for the week.
I don't mind trying out the stuff they are cooking.
Yeah, I'm telling you. So, and again, from an entrepreneurial perspective, a lot of people who were making things at their home and saying, well, I'm not sure if I can put that somewhere out there. That's where they tried out and say, well, you know what, let me bring it out in the market and make a couple. And if people are really into it, then maybe have some. So every Saturday, you pay for your booth and you have your little thing, you perhaps study for a little table, and then you say, well, whole booth to have your stuff. And then that's how restaurants were born. And not just restaurants were born. Healthy restaurants, healthy options, because that's what is lacking here in St. Kitts, is that it's too difficult to find healthy food and it's too expensive to get healthy food.
Well, we are here on ZIZ, and we thank them for airing this, and we want them to, we're going to put it out, we're putting it out there for the leaders of the nation to hear, because we want to go back to the pot. And the farmers market, Dr. Pierre will be starting, and Care Nursing Agency
Dr. Pierre and his
will
boys.
be right behind you, because I am willing. I had no idea Doctor had this as one of his babies waiting to be birthed.
While you're speaking, I'll Google on my phone to show you the number of conversations I've had with farmers market.
Well, I'm very much interested, because we need to go back to the pot, and this is one of the lifestyle changes that I think would actually bring families together. Imagine you're going to a place where you can have nice, good quality food and service from our very own. Some of the produce that we see here are so nice. The difference when they are imported, and when they are really fresh and coming from we have a lot of great farmers. When we had the elderly drive-through, a farmer gave us some nice squash, okras, greens. Does you remember? Fantastic. Nice. They were so pretty when we washed them and we laid them out to pack in the bags. And I don't remember that farmer's name, but I'm gonna get your name again, because I have it on record, so you can come on board. And all those people who like to try new dishes like myself, I don't mind having a booth and buy from the other person and create my foods right there and in front of people, because vegetables are so easy and quick to prepare. It's nothing too.
It's to prepare.
You don't have the grease to deal with, and a lot of smoke.
I made a lasagna like last week, or a few weeks ago. I made a lasagna and it was eggplant.
Yes,
right? There was no pasta in there. It was just eggplant, and then and when you taste it, the last. I don't think anybody ate this and said to myself, "Wow, I wish that was pasta." Nobody had that. You don't miss it. You don't miss it. I hadn't eaten meat for a very long time, and I found so many ways to actually use dragon fruit. Who knows, dragon fruit could taste like chicken. You could add any flavor to dragon fruit that you wanted. You can make tuna out of it, tuna paste out of dragon fruit, stewed chicken. So many ways to use dragon fruit.
Okay, we have a lot to talk about after.
Yeah, right? So I think the farmers market is
I'm excited, and that point only was brought about from the main thing, eating plant-based foods.
Yeah.
Now we want to eat more grains, more. Even in our bread, we want to see more grains and in our cereal. So I have started to not buy the pretty ones. The color and all the additives.
Yeah.
We have the multigrain, 5-grain cereals. Those are what we should opt for when we taking the children to the supermarket. We have to start. We can like put a bowl of the dasheen and all of that, but some of them still have a bit of sugar.
Yeah.
But the fruity ones, the colorful ones have more. So we want to try move away from the color You know, we have to teach our children. If we don't know, as you said, they won't be able to adapt to the changes as adults.
Absolutely.
They'll already have the palette for these things. So we have to start in the home.
Yeah.
So
yeah, absolutely, and Keisha, we have to start in the home. And you know, one of the things that the marketing industry in the U.S., one of the ways they found to get into parents' pocket is to market to the children. Because if you want parents to buy something quickly, make a child go crazy about it, and the parents will get into it. And it's one of the things that I think we also have to use that same avenue. Because I think where we really will make the changes are the children. If children start demanding healthier things to eat, there are kids. I'm so amazed when I see young kids today. When you give them something sweet, they're like, no, because they're turned off by the sugar, and because because the parents started them on a healthier track, right? And I think if we can do that for our kids, that's where. So again, because this is not just a personal issue, because it's a national issue, I'm always going to circle back and try to appeal to our leaders. The school feeding program, right? Those are areas where we can make that sort of impact, and we can make those sort of changes. When I was in St. Lucia, I served on the prison board in St. Lucia, and one of the things that I was very proud of that we achieved was using prisoners to plant and grow the foods that we use to feed the hospitals and the schools.
That's
right?
a good idea.
You have a lot of manpower sitting in prison, man.
But actually, our prisons are getting more educational because they offer classes, and we had they had a baker in there, and they teach them how to bake. So the same concept, teach them how to grow.
And teach them how to bake healthy stuff, right? Because when you look at you worked at the hospital, Keisha, you work at, and then as a doctor, when I write my treatment plan, one of the first things that after I say admit to the ward, whenever you come across one of my charts, you can take a look at it. After I say admit to the ward, the next thing is the diet. If it's a hypertensive, diabetic diet, or whatever, renal diet, whatever, I would write the diet in there because I found that's very important. But I lament the fact that sometimes when I look at what the patient is eating in the morning,
it's not what you want to order.
It's not just not what I order. It's just something that should not be served in the hospital. Period. But I understand why sometimes those decisions are made, right? Because sometimes it's better to give somebody something rather than nothing at all. Again, healthy food is expensive, but it breaks my heart when I have a patient who's hypertensive and the patient has salami for or lunch and meat, or one of those things for a thing. I say, why is that even being served in the hospital? So we have to look at very creative ways to see how we can actually supplement the food supply. And if we have to start with community-based markets, right? Or if you dedicate a plot of land, for example, to a certain community. That's why when I went to the Seventh-day Adventist Church a few months ago to speak to them, I said, as a church, you can do more, right? And I always the churches always think I come down hard on them, but I said you're a community, and a very influential community, and there's too much God and too little good, right? And you have to get out of the Bible and roll up your sleeves and get stuff done. As a church, you can get a plot of land and you can plant and grow stuff that you can give to your members. They can buy it back from you, right? For next to nothing. All you need to do is just for irrigation and for seeds and whatever the case may be. But those little groups can come together and start growing healthier foods, right? Again, the prison thing is something that can and should be looked into, because this individual was, and you know what? It was a win-win, because the prisoners felt they were doing meaningful work. They were getting a little 25 cents or $1 being put on an account for them, so they were earning a little income. If you're in prison, you can send $5 or $10 out for your child, because you made that while you're sitting in the prison. And at least you come out with a valuable skill. You come out of the prison and you move straight into farming.
Because they're going to continue.
They're going to continue because they recognize. So you would. And you gave them awards in the prison, so it was an incentive for them. You understand? Even those, not everybody got to work in the farm, right? If you had to be in your best behavior to go out to work in the farm, so for them,
they would be happy to go.
Absolutely. So it was an incentive in the prison, and the hospitals were benefiting from it.
I don't know who is listening, but I think this is really a great It would help a lot.
It would help a lot. It would cut our import bills. I mean, we're importing everything in this country, from spinach to broccoli to kale, to name it. We're importing so many things, and we have fertile soil. We have perfect weather all year round.
Yes,
we have the capacity. And I'm saying that everything doesn't have to be millions of dollars, and we can do things.
We could put this money now into something that, like an MRI, because we need that.
Exactly.
All of this money is for food.
Right.
We'll be growing our food, and this could be channeled to somewhere else in health.
Yeah.
Not taking away from health, but putting it back into health, but in a bigger way, because we need an MRI.
Yeah. Yeah.
Okay. This is a good conversation. Our next point, we want to make sure we are free of being dependent on tobacco, illicit drugs, alcohol, because once we want a healthy 2021, we see a lot of bars promoting a lot of functions, and even though they're promoting fun, and we know we're fun people, we are promoting alcoholism, we're promoting illicit drug use, and that don't mesh right now, because we have younger, and it breaks my heart every time when I see a young person, 20 and below 40, basically having strokes because of overuse of drugs and alcohol.
Yeah.
It's not pretty, it's not fun, it's not cute, it's downright stupidity, because young people don't realize that, like Doctor said earlier, a lot of the things we see now are diseases of the elderly. Old age brings about changes that are naturally occurring, but now we are seeing these changes now, in the now, young people.
Yeah.
Can you expound on that, Doctor? Because
yes, I mean, this is also another area that is very dear to my heart. A few years ago, a study came out, and some islands in the Caribbean, and I dare say the Eastern Caribbean, were the highest number of alcoholics per capita in the world, right? Because for us, alcohol is a social status. If you can drink top shelf or whatever, or you can go out, and you see people go out, and sometimes they don't want the beer bottles taken off the table, because for them it's a status symbol. I drank a whole case of Guinness, and it's a talking point, right? So we found a way to romanticize alcoholism, to make it even attractive, right? People are very happy to say that they got wasted last night. They were so drunk last night they couldn't.
I don't mind if people try something or have it as a, I'm treating myself, or it's an occasion, but we are not doing it like that. We are doing it every day.
We're doing it every day.
We're
doing it every day, and we also have the amount of alcohol that is consumed and considered social drinking is alcoholism.
Yes.
Right? So just the sheer tolerance that somebody can consume that amount of alcohol and drive from here to St. Paul's, it tells you that level of tolerance for alcohol is an alcoholic, right? And you don't have to drink every single day or get up in the morning first thing and open a beer, but just your tolerance and also your physical dependence. There are a number of individuals, I will tell you personally, I'm an introvert by nature. Most people don't know that. I have struggled with my social anxiety a lot. Typically, my favorite place is at my home on my own. I'm not the most sociable person, but when I come out, I have found a way to overcome all of this, and so I'm very picky as to where I go. But ultimately, when I do come out, I interact very well with people now. But before, I needed a drink to do that. I had to drink something to loosen me up and to make me feel comfortable, to get rid of the social anxiety. But we've gone beyond that, though. To the point that I remember there was a time when I decided that I was going to make a lifestyle change and stop drinking. And it almost seemed that I lost my friends in that process, because I would go out and say, well, let's make a round of drinks. And I'd say, I'll have a water. And people would say to me, I'm not buying water. If you want water, buy it yourself. I'm buying you a drink. I'm sure our cameraman here can relate to that. Mm-hmm. If you're not drinking, you make people feel, either because they feel guilty about it, somebody feels disrespected. But alcohol seems to be the lubricant that stimulates our social intercourse. That's what it is, right? If you're not drinking, You cannot speak, you can have a good time. So alcohol is at the center of everything. It's unfortunate that we see sporting events and being sponsored by an alcohol brand. And you see, but this is kind of incongruous because a sporting event which is supposed to be healthy, sponsored by alcohol. Or you see guys, I know guys who play football every single day, but they're carrying a big beer belly because after playing 90 minutes of soccer on the field, they go and stop at a rum shop somewhere or knock up a couple of beers or whatever you call it, or knock back a couple of Guinness, right? There are a lot of young men today who feel that, you know how many young men are struggling with erectile dysfunction? Because they feel that Guinness is going to increase their sexual prowess.
It doesn't.
So Guinness or Ireland, yeah, they saw a little salt in brandy or whatever and so on, all the things that people think that increases, and all it does, it heightens the desire because you feel horny, but it reduces the effect.
Yes. Young people, it doesn't help. It makes it worse.
So a lot of individuals, so there's a lot of misconceptions about alcohol, first of all. I mean, you have to be honest about our consumption of alcohol. I believe that, honestly, I am all for something called a sin tax. Because so many of these individuals who are alcoholics use so many of our resources. How many times are you in the emergency room and you see an alcoholic being brought in through the emergency? You know what it costs that every time you have to get an ambulance crew to jump into an ambulance, use the fuel, use the energy to go pick up somebody down there. That person comes in and that person is not somebody who has the capacity financially to pay for the resources he or she is using, right? And then you have that person treat them for a little while, only for the next week the same thing, and you see the same faces all the time. And these people are using resources on the road. The road traffic accidents.
And they are not sick.
Right.
But we have to deal with it.
Yeah.
Deal with when they're withdrawing, they become combative, even violent.
Right.
And then sometimes they get sick because they hit their head.
Yeah.
They have a seizure in the process. So it complicates it even more now. It's a struggle.
Or that person who runs into your car on the road or runs you off the road. Right? Because that person is drunk. So if you combine all the things, and you talk about unhealthy lifestyles, so you're part of a group of individuals that encourage alcoholism. You out fetting late every night and you don't rest adequately, so you're tired more than anything else. And because you're tired, you don't have sufficient time, so you eat unhealthy. You're already on your way to some sort of non-communicable disease, right? And then you have an alcoholic sort of behavior, and you just look at your social circle. Right, most individuals who are alcoholics, just look at the family life. Very, very, very unproductive. Spouses who are unhappy, kids who are being abused. It's one of the things that we saw during the lockdowns. Right, we saw people who had never spent so much time in their homes before. And the only way they were coping was to drink as much as possible. Right, so the alcoholism rates went through the roof, and so too.
Well, I was happy that they, at one point during the lockdowns, they had curbed the alcohol consumption. They weren't allowing you to buy, and that was a great initiative because people were getting drunk home and actually causing havoc, abusing their wives and girlfriends more so than before. Because before they would have been outside drinking, but they were drinking home, and that was creating a problem. We saw some of that at the emergency room. I was so shocked, but nothing is shocking right now. But this is a problem. We entertain these fetes. It's okay to have fun, but can't we have some clean fun? Why can't, like I'll say to anyone, I mean, if you feel like you want to be seen, have a malt, but it's in a cup, they'll think it's a Guinness. Have a Vitamalt or Giant Malt. If you want to have a top drink, clear drink, have a thing or Pierre Jello. Nobody has to know what's in the cup, you know?
But also, Keisha, too, I think we need to, again, alcohol, like a lot of those things that we talk about, they're bigger than just a personal decision to solve them, right? It's very hard for the person who has a social circle where you consume drinks and the person who's alcoholic who feels that I'm in total control of this to actually make those changes. It takes something very significant to happen in your life for you to actually want to make those changes, either because a certain illness, death of someone, or you were in an accident, something very drastic.
But then by the time we realize, or the individuals realize, it would be kidney failure.
Well, yes.
It'll be a stroke.
Well, kidney failure, heart attack, but also depressive illnesses, depression. Alcohol is a depressant.
It shouldn't have to get us to that point, because these people live somewhere, they have families, I mean, we don't have much support group for alcoholics here.
Yeah.
We had one before at the end of the private ward. It was in 2.
Right.
We don't have that now. We had an alcoholic network there, but we don't have, we need to have that because there are a lot of alcoholics, and you know, alcoholics don't look like the normal man on the road that we might see who have nobody who to help. We have alcoholics dressed just like you, doctor.
Yeah.
You know, sophisticated in town, and they are drunkens, and they abuse their families verbally, their children, psychologically. It's a lot. We are a sick nation.
But again, Keisha, you know, the point I'm making is that again, I want to appeal to our national agenda. We have, this is beyond. So this group, the Alcoholics Anonymous that you spoke to, which existed, the church will forever think that because I don't attend church and I always talk about the church. But I would say, this is one of the reasons why I'm always at odds with religion and what it stands for, is that the church is a perfect place to have a support group for alcoholics, right? I talk to people like this guy who was an alcoholic, and I remember once the one who passed away. I spoke about it earlier. A pastor was in the church and said to me, "You don't come to the church anymore." I said, "But do you go to him?" Right? Church has to go beyond people coming to you. Go out to them. Go where they are and find them. The Bible speaks about fishers of men. You see fish come and land and meet people?
But the only people that go anywhere is Jehovah's Witnesses here.
Yeah, but
nobody going nowhere else.
And everybody's suspicious of them, so nobody opens their door when they come. Right? Everybody's suspicious, so once you hear Jehovah's Witness, you don't open your door. But I'm saying go to the rum shop, where they are. Go find the people. Go and say to him, "I'm coming to get you on Saturday to come to church with me. Or on Sunday to come to church with me." Fishers of men. That little example set by Christ says that you have to go out on the ocean, on the sea, to bring in the fish. Fish don't jump on land and man waiting on the shoreline for it.
But this is the thing, doctor. We want things a certain way. And we are set in our ways as a people, as a culture. We want, like you said, people to come to us. Yeah. We have to go. We have to go and we have to change. If you see this ain't working anymore, you're going to stay doing the same thing all the time with no results. Yeah.
You have to go. You have to go. You have to also implement things that are going to curb those practices. Breathalyzer test is something that needs to be done. You stop randomly and see the alcohol content in their blood, and that person shouldn't be driving. And put points on the ticket like you do in the US, and eventually at some point you lose your license or you have to reapply. Exactly. Those are the things. Stop selling alcohol to people who are notably drunk. Somebody who's drunk, as a bartender, you should say, because take for example, if somebody gets into a traffic accident and kills your son or my daughter or somebody, a family that we love and so on, and you would trace back that person went to X establishment and was there from 9 o'clock in the evening until 1 o'clock in the morning and consumed a certain amount of alcohol and spent X amount of money, that establishment can be taken to task, right? So those are the things that you say, if you're a bartender and you recognize that somebody's notably drunk, you don't sell alcohol to them.
Make sure they get an Uber home.
Right, exactly. So those are some of the things, and we can do that, and we also have a personal responsibility that if we go out with somebody and recognize that person has had, if you're my friend and I have so much influence over you, I should say to you, hey, you really shouldn't drive home. Right. I'll take you home. Lock your car. Let's put it in a safe place. And I'll take you home, and tomorrow morning when you're better, we'll come back and take it.
So this is being responsible. Absolutely. I think people put the responsibility on others, and they should really take ownership of their actions. I think we tend to don't take responsibility and take accountability. Yeah. And we pass the buck on, because as a bartender, you see, they have to be falling down and they're still buying them drink. They're still passing the drink. They're giving you the drink to give him and he done on the ground. Yeah. Because we want to make that money for somebody else, because it ain't even your business. Yeah. In your establishment, but you're making sure that these people's pockets are full and our country is dying.
Yeah. It's sad. And again, as I said, it comes back full circle. The money that we claim to be making here, we're not spending it in taxes or going, our hospital bills or whatever the case may be. It really comes back full circle. We all suffer. Those decisions that we fail to take, the ones that we ignore, we turn a blind eye to or we're selfish about, it comes back full circle. This is our country. We have to live in it.
And then it's not only affecting us, like you said at the beginning,
Right.
it's going to eventually affect our children.
Yeah. Yeah.
Staying hydrated. Plenty people don't drink water. I don't know why, because it's like a big deal here. We love water, but it's a lifestyle change. People are not accustomed. In order for me to start drinking more, I started buying the bottled, because it was so easy to grab. I call it a grab and go.
Yeah.
It's pretty cheap. Water is cheap in St. Kitts. I cannot say water is expensive unless you buy the higher end brand.
Yeah.
But water is water anyway you put it. And grab and go is a good thing, because you probably would not want to waste the time to go and throw it out of the container in the fridge, but you can grab it and travel with it. Yeah. And we have those nice water stuff, the bottles, the fancy. We could even put it in that, but our country is not hydrated. Too much people come to the hospital for dehydration. In St. Kitts, where water flying all over and free? No.
Yeah, yeah. Well, again, it's also the culture as well, right? I mean, so many people, when they're thirsty, drink a juice. Right? You see kids. I have a nephew that, I mean, you have to incentivize him for him to drink water when he's thirsty. Say, well, if you drink water, I'll give you, because if there's juice in the house, he drinks juice like, I mean, it's insane how much of that he drinks. So that, imagine if that's where your hydration comes from. Water is certainly not appetizing or palatable, right? We don't drink, and speaking of the dehydration which we see,
we shouldn't be seeing dehydration in St. Kitts.
Yeah, but we
didn't have no drought. You here? We had a drought.
Yeah, so we are seeing the dehydration, but we're also seeing the consequences. I was telling you that last year when I was at JNF, I had cause to write to the CMO, and also spoke to other individuals as well about it, about the fact that during the summer we saw a spike in the number of individuals with clotting problems, because the blood had become so thick, so viscous that it increased the risk. And of course, when you have that sort of dehydration coupled with obesity, with all the atherosclerosis and all those things and so on, you can see why strokes and all those other things shoot up right afterwards, because people aren't hydrating adequately. And even when they do hydrate, because one, we also have to get away from the stigma of, well, not just stigma, but the age-old adage of 8 glasses of water a day. And that is a very arbitrary measurement, right? One, nobody knows what the size of the glass is. 8 glasses of water a day, when my glass is this small, so I did drink 8 glasses of water a day. That's the first thing. The second thing is that you cannot tell the guy who's working out in the sun and the person who's working in an office setting 8 glasses of water a day. Right, because that guy who's out there is certainly using a lot more water.
So he should drink even more.
He has to drink more, right? Yeah. So really and truly, you should the amount of water. And I tell people, talk to your doctor about your occupation, where you work, and whatever, and so on, and what underlying conditions you have. Because at the same time too, I cannot tell the person who has heart failure would drink 8 glasses of water a day, because the body's already having difficulty getting rid of that excess fluid. So, there's, again, we have to get away from the cookie cutter syndrome, that everything that we say, we just put out a statement and say everybody has to go drink 8 glasses of water. You have to drink water based on what your requirements are, based on what your job, based on what your occupation is, right? So that's important. But drinking water is such an easy thing. And Keisha, I beg to differ. You say water is cheap here, but at Costco, if you live in the US, at Costco you buy a 48 thing of water for $3, right? So when you look at the price of water in the US versus what I spend here, for $20 for a case of 24 of this.
But this one is $17.95 a case.
Still expensive. I find the person who has $1,000 in their pocket and says to themselves, this has 0 calories in it. Juice is part of a meal for most people because it has sugar. It's a way to actually, because when people drink a lot of juice, they eat, belly is full, they're happy. Water has no calories. So most people think, well, yeah, you drink water, but if I have $17, do I buy something to make juice or buy juice versus buy water? It's for those who can, it doesn't seem like much, right? I typically don't buy juice for my home at all. I don't have a habit of buying juice. I buy water. And if you go to my home, by every bedside, there's a couple of bottles of water there at my bedside, because in the middle of the night I get up and I'm chugging water and stuff. I even got a bottle recently that is connected to my phone that tells me how much water I've drunk for the day and how much I need to drink. So the bottle does that, yeah. So and it was a gift from Social Security. Thank you very much. You know, that it's kind of my smartphone just to remember to drink water throughout the day. Because the reality of it is that we do not drink sufficient water. But Keisha, I'm going to stop you there for a minute. I'm going to tell you why some of the statements you make about water being readily available, that's true. But that's not entirely the whole story. I have worked at GNF. And I will tell you what the reality is. I've worked on the medical ward, and there isn't a single place to have a drink of water on the medical ward. If I want water, I have two options. I can go to the ICU and beg the nurses there and pay for the water. I can go to the private ward and there's a box where you pay, because the nurses are actually putting money together to buy water. That shouldn't exist. That shouldn't be. If you're working in an institution, in the conditions in which you work in, there should be water fountains in every corner that you turn, that you as a nurse or a doctor or any staff member can go in and get a drink of water.
Yes.
That should exist. That doesn't exist. There are times when I typically don't have money on me. In the day and age of cards, I never have coins or money on me at all. If I don't have $3, I can't go downstairs to buy a bottle of water. And sometimes I need 2 of those, so it's $6. That is a lot of money. So a lot of the things that I want, and perhaps I'll have a 30-second at the end to tie this in and tell you why this is a responsibility for everybody. If you have workers in your place, there are certain things that it doesn't cost anything too much from you it doesn't affect your bottom line so much that you cannot make those things readily available for people.
Okay. Yeah, I agree.
In an entire hospital, the nurses shouldn't have, a few nurses in the ICU shouldn't come together and put some money together every month to fill a bottle of water, or the ones in the private ward. That should be everywhere. I have worked at a hospital, and sometimes during the summer, when I started working at GNF, I worked the first month was January. And because it was a cooler month like it is right now, I wasn't aware that the ward didn't have air conditioning. So when the summer came, I said, why is the AC off in here? And somebody said, which AC, doctor? I said, but there was AC when I came in. It said to me, oh, you mean it was cold in the thing? But during the summer, you sweat profusely. Try resuscitating someone. You've seen it.
I live it.
You're drenched in sweat.
I live it.
And after you finish drenched in sweat, you don't have a drink of water. That is the reality. So, again, we have moved past the stage where this is an individual decision. We have to change the culture. There has to be a paradigm shift in our thinking, in our strategy. It requires everyone to get on board, everyone to get involved, and there must be a national plan for creating a healthier nation, a healthier federation. It starts in every institution, every organization, that we have to consciously say that this is how, and it's something that, again, I hold myself responsible as someone I'm the vice president of Medical and Dental Association. I know we started an initiative called Run for Your Health, and it's something that we started, but it never got the drive because COVID came and took over all of those initiatives. But it's something that I would like my executive and my general body to start again, because it has to start somewhere. You're doing a great job here at CARE, but you cannot do it alone. You cannot do it alone. I think right now what you are doing is sensitizing people to the need for this. But this is not something that you or me, yes, we'll do it in our home. But if we really want to make the impact that needs to be made, because the problem is so ginormous, such a big problem, it has to be part of our national plan.
Yes.
It has to be part of a national plan. The way the building codes for our homes, proper ventilation, because right now climate warming is real. It's getting hotter. I see elderly people who come into the emergency room properly dehydrated, bone dry, because they're in a bed and somebody has gone out to work so they can pay for their amlodipine at the end of the day. And the whole day they've been there and the water is over there and they're here in the bed.
They can't
get access to it. This is the reality. That is what is happening. And they're in a hot room with a thick curtain or louvers that are closed, sweating profusely in a bed. Right? That is the reality. So we're building codes, how we build homes, energy efficient homes. The ceiling heights, those things are important. An air conditioned unit is no longer a luxury. In 2020, it's in 2021, it's a necessity because it's so much hotter now than it ever was before, right? So we have to raise that level of consciousness. In the workplace, if you are building a company today, if you are a gym membership, and if you don't have a gym membership, put a gym for people to work out.
Don't serve sodas, serve water, serve
Start serving
fruits.
healthier things, right? The restaurants on your menu, start including a few healthier options.
Yes.
On your menu. I'm not saying to change your entire menu. I'm not saying to become a vegan restaurant, but I'm saying that I, as a vegetarian, should be able to go to your restaurant. I should be able to get something on your menu.
Right.
It's not. I'm asking you to have 10 meat dishes and have a salmon dish at the end. I'm saying you can find a way to take chickpea or lentil and make a lentil loaf. Do something that I say, well, I can come here and this is where I can get it from. Those small changes. I have asked and I've appealed to governments every time over that if you cannot get people to pay for people's gym membership, make it tax deductible. Well, they don't pay, I think taxes are coming on stream here, but in countries that people pay income tax, I've always said my gym membership is not just my personal health, it's for the national health. It's for the national health, especially when we talk about UHC, universal health care, where everybody has access to care, right? Somebody has to pay for that. Who's paying for it? It's you and I, right? So it's in my interest that people are healthy, not because I'm a doctor. And there are ways to make money without people dying from diseases. Preventative care is the best kind of care. And we're so far gone, we cannot prevent a lot of diseases, but we can prevent the complications. I have seen too many DVTs, too many strokes, too much dehydration in the elderly, and even the young. Kids who are out playing sports all day long and not a drink of water. What they have is a Capri-Sun in their bag to rehydrate with. So we have to start having that sort of honest conversation, and in doing so, we can say, you know what, we need to have an entire committee of individuals across the board in the community, and let's sit together and see how we can begin to make those changes.
I think this is a positive step forward into 2021, because one of the things we need to touch on briefly before we wrap up is our mental status, distressing, because it's a lot. We are a more busy nation now. We are coming of age, coming into times. We are more technological, and all those fancy stuff is good. I mean, technology is good. It has it's good in its correct form. But for us insane kids, we don't want our culture to go down the drain. We want to still have our culture, and we want the children, yes, to be computer savvy, but we still want them to go outside and play, and to have fun like regular kids.
Absolutely.
Yeah, and not fear being shot, fear being knocked down because of some drunken driver. We want our mental status, and we had the conversation with Dr. Crawford here at the series about depression and our mental status. I think that should be addressed, because our nation is suffering. It's a critical. This is a pandemic for me. The disease processes that we are seeing, it's a disease process that we can't do anything about it. Some of it is too far gone. But the children, our future, we want to help stop it somewhere along the line, because the younger adults right now are on their way to a rapid decline, and our mental status, because of COVID, with being locked in for so long, that had played a role in a lot of mental issues. We are seeing more of that now on the ward, where people are coming with issues because psyche can't hold no more. And we are mixing people with people who don't have no business being there, because they're now gonna get susceptible to other illnesses, because they're not there for anything physical. Internally, it's mental. They shouldn't even be mixing with what's happening. Gastroenteritis, because people cooking and eating all kind of things from all kind of people on the path. and that's why we just had that talk as well, gastroenteritis.
Yeah.
So our mental status is affected, that I'm mentally drained because I want to do so much, and I don't know how. Yeah. This is my way of letting it out, embracing all these topics because they are timely. Every single one of them tie into another one I just had. Every topic now ties into something that we previously did to come, and our mental status needs to be addressed. We need help. Yeah. Doctor, all of us, and you said it rightfully from the beginning, it's affecting all of us, even those who are trying to make a change, a positive change, that is, because change is change, but we want a positive outcome for our federation, and we want the leaders. I hope somebody forwards this video to the necessary people so they can reach out to us. We are here, doctor is available, we'll make the time. Yeah. Because we need to do sometimes the planning process, doctor. We have the higher ups, but they don't know what's happening, Yeah. You need to speak to who is in it. I always say, you can't make decisions without the little man. Yeah. The small potato, they make an impact, but how would you know if you don't have a conversation? Reach out to the smaller man so we can all say something and not always look at who is up here. Who is up here ain't even living this story. Yeah. They will be affected eventually, whether it's them personally or a family member or somewhere along the line. Indirectly, they might be affected. But we don't want just people who just up there to make decisions. We want the middleman, the underdog, the nobodies. Everybody is somebody, but some people consider we have nobodies. These people if you listen to some people on the street, they make better sense than who in positions. Yeah. Because they live in it.
They live it every day. So
they're suffering. We are suffering. Can you speak just briefly about our mental status? Yeah. What is happening with that? What can we do?
Absolutely. And Keisha, this is again you've touched on something that is dear to me, again, for more reasons than one. I have struggled with depression. People who know me closely know that. From most of my adult life, as a matter of fact, and it's something that I speak about very openly and proudly, for the simple reason that I have come to recognize over the years that depression is so underdiagnosed, right? People go through very, very severe forms of depression, keep it a secret. One, because there's a stigma attached to it, right? If you're depressed, you're weak, or you can't cope. But just look around us. Look at what our life has become. People have 1,000 Facebook friends, but not one person they can talk to. It's like being alone in a crowd, right? You want to talk about health? We have to first look at what man really is. Man is biological, this is the body. He's social, the environment in which he exists, and he's also psychological. If any of those things, so even if you fit as an ox, physically, six-pack and muscle and everything, but psychologically, you're not at peace, you're not healthy. Or if you have all those things but your environment is somewhat toxic, you're also not healthy, right? So when we look at health, and a lot of us look at health from the perspective of how much exercise we get and the foods we eat, the rest we don't get, we also have to think of health in terms of our relationships. Our relationship with our Creator, our relationship with each other, because those are the things that have such a negative impact on the state of mind. If you, as a man, it is believed, and that's what's the chicken and egg scenario, that as a man thinks, so he lives, or as a man lives, so he thinks. Either way, it boils back to how do you view life? How do you view things? And this is why so many individuals right now, if you make all of these changes, but you're in a toxic relationship, romantically, friends who don't encourage your healthy lifestyle, you begin to feel isolated. We now live We now live in a way that we compare everything. We compare our foods because when the first meal that we get, we look at it and we say, oh, this is good. Instagram or Snapchat. And we live here now comparing our lives in real time with others, right? And whereas people are really just posting snapshots of their life. That's not the whole life. No. Snapshots of their life. You don't see the whole picture.
Right.
But Keisha has worked for 10 years to buy a car. And Keisha puts a car out there because she's happy, she feels accomplished. She's bought herself a brand new car on that day. And she posts it out there. Suddenly somebody's out there who went to school with Keisha, who has not bought that car, begins to feel that they're a failure and struggles. And you know the worst part about it? Is that you are surrounded by friends who reinforce those very same ideas in you. There's not one person in your immediate circle who says to you, hey, that's not so. You have achieved because you have done so, and the reason why you don't have a car is because you sacrificed in this and this area to pay for something else that Keisha may not have, right? And this is just a small snapshot of Keisha's life. If I tell you what Keisha is going through before she got that car, I'm so grateful for her. You have individuals around because we're surrounded by people who think like us, who behave like us, who eat like us. And that's why I said to you earlier that it seems to be coming in a way that non-communicable disease is a sexually transmitted disease. Because people who we spend the most time with suffer from the same things because they think like us. We are in a place where, for example, religion no longer plays the role it once played in our life. Religion shaped our morality, gave us moral direction. We could discern between right and wrong. Right now, right and wrong is whether it actually contributes to our pocket in one way or the other.
Yes.
We shift our moral goalposts constantly. We do things and make decisions that we can barely live with ourselves.
And justify it too.
And justify it too, right? The things people would do for $1 today. It's incredible.
Recognition, sometimes it's so sweet.
Right? It is incredible.
It's sad.
So we are living in a very toxic environment where we no longer have the sense of community. It was, you know, when I came to St. Kitts, one of the things that I found most difficult to come to terms with was how small this country was, but yet still just how much people were left on the wards, abandoned. You say, well, where is whose family? Who's coming to care for them? Elderly people on the ward, and you see them there and you're like, I just, but that person doesn't have a child or somebody somewhere, or even if you don't have a child. I grew up in a community where I called all my friends' parents mommy and daddy, and auntie this and auntie that and so on. And you know what? It didn't just come for a title, it came with a sense of obligation. Because if you and I are very good friends and we grew up together and so on, and Keisha is our mother and Keisha is at the hospital, I feel just as obligated to go and care for her as you would. That sense of community is lost because everybody is trying to see how they can get ahead on their own. Well, there's a good proverb for that, you know, which says, if you want to go fast, go alone, but if you're going to go far, go together.
Yes.
And we're not going anywhere because we're not going together. Everybody thinks they can get there on their own. And that has created, what that has done, it has caused so much social isolation where people are struggling with things that there's not one person that they can call in confidence and speak to, because the person you speak to about something takes that and suddenly starts feeling better about themselves because, oh, I didn't know Keisha was going through that. I'm actually doing so much better than Keisha, right? Our religions, our schools are no longer safe places for us, right? Churches are places where people are becoming abused.
Yes.
Schools with teachers who perhaps are more stressed than the children that they're teaching, right? When I had a teacher back then, that teacher was almost like a mother figure or a father figure. That's somebody who cared for me, who would come home and sit with my mother and talk about something that they've noticed that I'm experiencing. So that sense of community, which the thing that the Caribbean has had as its superpower,
it's gone.
Is gone. So when I see you doing the work that you're doing, I tell myself how old school you are. Because what you're doing here, it's not for money. Based on the amount of work you have done so far, in the time I've known you, if you were getting $1 for everything that you were doing, you'd be a millionaire already.
It's no money.
By virtue of, so that sense, so imagine if I could clone you. I could create a few Keishas who had that sense of community, who felt that, who had that social conscience, who said, you know what, this doesn't sit well with me, I must do something about it. Even if I have to do it alone, I will do something. If we had that, if we brought back that sense of community, we'd solve our expensive, healthy food problem, because we'd go together and take a piece of land and say, well, you know, I have an acre of land I'm not using somewhere, so let's get together, and that's what our community. We'd solve that problem. If we had that sense of community, we would need to have Alcoholics Anonymous. We'd have support groups for everything, for women who are abused, for people who are sexaholics, for people who are alcoholics. We would have support groups for all those things in our churches and in our communities for people to go to.
Our children wouldn't be left alone because we have 2 jobs.
If we had a sense of community, if we had a sense of community, we would solve a lot of the health problems. If I felt responsible for the next driver on the road, I would not drive drunk. That's what a sense of community does. So our unhealthy life, we can break it down and look at it from the very minute and singular way, in the sense that, oh, well, somebody's obese and somebody has this disease. No, we have a toxic nation. And it all starts with the mindset. A lot of us are functioning, depressed people. See, but sometimes you go to work and you can feel the atmosphere, the energy. People come to work on a Monday morning and you can sense the toxicity, like it's coming off their breath in the morning.
Yes.
Angry more than anything else. And I've learned that a lot of these individuals, if you were to take some time and dig into their life, they're going through a very difficult time, but they have no way of showing that darkness, they wear it like a coat in the morning. And that's why these days, I tell people, at least from 2 years ago, when I ask you, how are you? Is because I am willing to sit and listen and see how I can assist if you say you're not okay. But most of us say, how are you? And we have a knee-jerk, I'm okay. All right. That's what I don't think is, all right. People say like, knee-jerk. And that person is not doing all right. But it's the knee-jerk response. So we leave, the relationships are not real. They're all fictitious. And we have social media that has added to that fiction, right? Because we all want to seem to be doing okay and better than the other person, rather than saying, let us all do okay together. Let me leave my home on a Sunday and come here and sit with Keisha and have this conversation, and hopefully somebody can get that information out of it. And there's no money to make from it. No. I don't have a private practice. I'm not trying to, I'm not running for office. Just a sense of community. God gave me a knowledge. I've been in the practice of medicine for a while. Let me see how I can use it. The purpose of our lives is to discover what our gifts are, our God-given gifts are, and then to give it all away.
Right.
That is the purpose of our lives. That's why we're here. To discover what you're good at, because we were all born with a very specific and defined purpose. We must discover what that is. We must get great at it, and we must give it away to humanity. That's our purpose. That's what spirituality really is. Spirituality is, we talk a lot about religion, but spirituality is a connection to each other and to a being that is bigger and larger than all of us. And that connection is nothing more than shared love and compassion. If we had that, and we sat and we had real conversations, I'm not knocking back 10 guineas of my brother there. And when I'm sitting having a real call, I say, boss, talk to me. Mm-hmm. What's going on? How things, I've seen you looking a little different lately and so on. And my brother feels vulnerable enough that he can cry and break down in front of me and know that I can just want to say, it's going to be okay, boss. I don't have all the answers, but here's how I think I can help you. Or I went through something similar the other day. Here's how I think I can, here's how I dealt with it. If we had those real conversations, no, but by an hour after an hour together, we're too drunk to have this conversation. So we have something very superficial. We talk about a woman or a car or something that makes no sense at all. So these relationships are so empty, vapid, empty conversations. And Keisha, we talk about mental health, and we like to go to mental health and talk about the person who is schizophrenic and the person who has a psychotic break. But the epidemic that's affecting us is those depressive illness, anxiety. Many people who people are taking Xanax and all these benzodiazepines in ways that they never took before in their life. People are struggling. Yes. People are struggling. And you tell yourself, we have before, when I was growing up, I had something called a pen pal. Most people know what a pen pal is.
Yes.
But a pen pal used to write a letter to somebody you don't know anywhere in a country, and you used to be at the post office waiting for that letter to come back. These days we can send a message and get an instant response. We can have thousands of people on our phone. And our relationships are so much less meaningful. So I want to end by saying that this is a moment for reflection. And as I'm talking here, I may sound like an expert on this, but the reality is that I'm taking a lot of my own advice for myself right now and saying, how can I in 2021 start making those small changes, right? Those small changes that over time are going to bear some fruit, not just for me, but for my family. And if I do something in my family, imagine if I had a home with 3 kids and they all went to school and started behaving in a different way in school, or started speaking a different way in school, and my wife went to work and she spoke a different thing in a workplace and so on. Just imagine the ripple effects of this. Just imagine how this sort of mushrooms out. And before we know it, we're on to something. So this is not all this advice, a lot of it I'm taking for myself. Places I need to make those changes, but I recognize them. And I'm urging you now to sit, reflect, and ask yourself, how are we going to create a healthier nation, not just for ourselves, but for our kids? What are we going to leave our kids behind? What are we going to leave them with? Because so many of us are so consumed with what we live this world with, and not what we leave behind. Right? So many of us. We think that if we make as much money, and just look at the rate of inflation, you really think that if you make $1 million today, when your kid is 18, it won't be worth $1 million anymore. Because the cost of things are going to go up, the value of that money is going to be reduced significantly. But if you leave your kid with some values in a way that they understand that they're part of a larger community, and they can be instruments and agents of change, of positive change, you have given that kid so much more than a trust fund. And those are the areas where I think that we have to look at health in a more comprehensive way, and we have to recognize that this is a job for all of us. The only way care nursing is going to make a difference is that we join hands with Keisha and others like her, and together we say, how are we going to come and do this?
Yes.
And hey, those of you who think, well, but there's no money in it, if you want to make $1 million, help 1 million people who are willing to pay you $1 for it. The more people you help, the more customers you have. The longer they live, the more productive they are in their life, the longer they can pay you. Yeah. So think about it. It's a win-win for everyone. Yeah. Keisha, I want to thank you so much for bringing me here today. And I mean, there's so much to say on the topic. Yeah. And you know, the last area, which is mental health, is really there to me, because I struggled with depression for a very long time, and I know what it's like for people who struggle with it, and imagine me as a doctor going through it and not knowing who I can talk to, where to go, where to turn, you know, because my friends looked up to me as having the solution, so I should never have a problem. In my family, similar, and in my own profession, I mean, I'm a doctor, and I come to a colleague and say, I think I'm really going through a depressive moment here. Just the stigma, you know? So those are the things that we have to start changing. Those stigmas that prevent people from getting the care that they need. Yeah.
Well, I had some points there, and I have this to look back on. Dr. Pierre, I'm so grateful, because I too want to put it out there that, yes, care nursing agency, you know, appears to be everything that people, the expectations are probably very high, but just know that we are normal people. I am normal. I have my struggles, I have my setbacks, I have my mountain tops. Sometimes I have to swim the whole ocean, but I try to get things done. And yes, sometimes I am too depressed, because when people look up to you, the expectations are very high, yeah. And it's a tall order for someone like me. I wear many hats, and I have to execute. And I know I'm trying to make a difference. I know I can't do it alone. That's why I call on people like you for your expertise, because there's no one person in this thing. It's a whole team of us. and we go into the homes of the elderly, but we have people who come to the office, a family setting, where everybody visits, and it's a family thing now. And family health matters to us, just like we are committed to home care. And I do have struggles, because we all do. And I don't let it stop me from making sure that the valued information or the current time information is put out there.
Yeah.
I want to personally thank Mr. Winslow Iduport for taking his time out every Sunday, any day actually, to come and capture these sessions. And I also want to thank ZIZ for airing them for our people, because some people are behind the TV because they can't come out of their homes. They are bedridden. They're in situations where they just need to be in right now because COVID is still here with us. And I just want to say thank you, Dr. Pierre, because this is a Sunday where we are busy. This is your one day to get a little peace and quiet. I've finished a night shift and I'm still here. And we are here because of the people. There's no money to be gained. There's no status. It's not about that. We are put together because we had to, right?
Yeah.
We had to look the part a bit, but we both have our own personal struggles.
Yeah.
So let it not be said that our life is put together. Doctor put out so much things here. I'm so sorry that he has been going through this, because I too have been going through it sometimes. People just don't know.
Yeah.
Put together don't mean that we don't have issues, but that's why we are here to say normal people, professional people have struggles, and we want to make sure that the public is aware of all these ideas, because these ideas are brilliant ideas that could save our country, because this is the last days, I know that.
Yeah.
And I think we need to recognize that too, and that we probably would be limited in some of what we can do, but we are still here nonetheless. And because we are still here, our children are right behind us, our future. And whatever it would bring, we want it to be something positive, and we want to do something in the now. 2021, January 3rd is a good place to start. And so all these initiatives, I'll look back, because I would want to recap, and I'll probably do that from time to time to take your advice, because I think it's timely, and I really appreciate you coming. I know you're a very busy man, and I appreciate you so much more than you know.
Thank you.
And I just want to tell you thanks, because I'm sure this video should go viral, because this information is a lot. But we wanted a healthier 2021. Thank you for being a part of Care Nursing Agency.
Thank you.